Bismillahirrahmanirrahim. Dear student, today's topic is from the chapter Endocrinology. We will discuss today the hormones secreted from the anterior pituitary. What is this gland and what is secreted by the functions of these hormones which are secreted from the anterior pituitary. Anterior pituitary is situated in the base of the skull, where it is connected to the hypothalamus through the pituitary stalk, from where the neuronal and blood flows through it, and the hormones which are related to the anterior pituitary are secreted in response to the neuronal or hormonal stimulus. So the blood supply is also through this pituitary stalk, and it is present in the cella turcica. So the hormones secreted. This is the major gland of the body, master gland of the body, which secretes most of the hormones and which controls and at different levels of the body at target organs like adrenals, thyroid hormones, and hormones secreted from the female and male hormones secreted from the genital organs. So mainly we will discuss today the hormones secreted from the pituitary. First of all, we will say there is growth hormone. The most frequent and in large number secreted hormone is growth hormone. Then there is prolactin hormone, thyroid stimulating hormone, follicle stimulating hormone, and there is luteinizing hormone. These hormone, ACTH is also secreted from adrenocorticotropin hormone is secreted from the pituitary. Pituitary is basically divided into three parts: anterior, middle, and posterior. These hormones are secreted from the anterior pituitary. The human beings, the middle lobe is rudimentary, but the posterior lobe secretes antidiuretic hormone plus the oxytocin. These we will discuss posterior pituitary hormones later on. First, we will discuss upon these hormones. These hormones are secreted from the are regulated or secreted in response to the hormones from hypothalamus. Hypothalamus secretes corticotropin releasing hormone, which causes release of ACTH, thyrotropin releasing hormone, that is called TRH, that secretes what is called thyroid, TSH. And there is growth hormone releasing hormone that secretes growth hormone, and somatostatin, also called the somatotropin release inhibiting factor. This hormone decreases the secretion of growth hormone from the anterior pituitary. The prolactin inhibiting factor is also another factor secreted from the hypothalamus, and which is also causing the inhibition of the release of the prolactin at some stages. We are going to discuss it very soon, inshallah. CRH, growth hormone, gonadotropin releasing hormone, and TRH have all been used to test for pituitary hormone reserve. These are secreted from the anterior pituitary and the hypothalamus. The main function of the anterior pituitary is growth, development, thyroid function, and adrenal functions, gonadal function, and water and salt retention. So these all, even water, salt retention, and glucose metabolism is also regulated. Glucose, fat, and fat and lipid metabolism plus protein metabolism is also regulated by the hormone secreted from the anterior pituitary. So it is called the master hormone. First of all, the main hormone secreted from the pituitary gland is growth hormone. This hormone is secreted from the anterior pituitary. The main function of the growth hormone is in development. It causes the development of the soft tissue and bones growth. Normally it is secreted in this response, but sometimes in stress, physical exercise, and when we go to sleep, even after 60 to 90 minutes after its concentration is raised in the body. So main function of the growth hormone is to develop the human body. How it regulates the glucose metabolism by inhibiting the glucose entry into the peripheral cells. It causes the entry of the amino acids into the tissues and the mobilization of the non-acidified fatty acids to move from the adipose tissue to the liver. So this regulates the metabolism of different of all these proteins, fats, and carbohydrates. It is also secreted in the in a response to the we can say inflammation, like inflammatory response. Cytokines also causes the release of the hypothalamic pituitary neurotransmitters. These are all involved in the regulation of the secretion of the hormones. First, we were talking about the growth hormone. Growth hormone, there may be some increase in the release of the growth hormone. First of all, there is if it is before the growth of the long bones, growth hormone is secreted from the pituitary. It is called gigantism, and most of the times there are the large adenomas in the pituitary, which causes the release of the hormone, growth hormone. This hormone causes the elongation of the body skeleton, bones, and soft tissue. Every the tissue and long bones and skeleton is becomes very linear growth, causing very linear growth in and increase in height and weight, and but this also causes cardiovascular and neuronal diseases, and that may result into the death of the patient. And there is also the other deficiency is called deficiency is also present in the growth hormone. This may also be because of some tumors like adenomas that is affecting the pituitary and pituitary stalk, and then there may be irradiation or damage to the pituitary hormones, and there may be growth retardation opposite to the gigantism. This is called acromegaly, when the long bones of the skeleton are closed. So there is no linear growth, but the body of the person is affected, and there is overgrowth of the soft tissues and bones, and this also causes the fractures of the bone, maybe bone due to the bone resorption. This isolation and this hormone is this also causes hyperglycemia when chronic increase there is chronic increase in the growth hormone because it inhibits the entry of the glucose into the peripheral cells, and it also causes the glycogenolysis in the liver. So it causes increased growth. Next is it is also related with insulin-like growth factors, and mainly insulin-like growth factor 1, which is mainly associated with the growth hormone. Whenever there is increase in the growth hormone, then there will be increased level of IGF-1s, which are secreted from the different parts of the body, like pancreas or other gastrointestinal and tissues. And it is also regulating the IGF-1 also regulates the gastrointestinal or pancreatic hormones. So when we are going to diagnose acromegaly or growth hormone, we cannot depend upon a single measurement of growth hormone. Why? Because it is secreted in the pulsatile fashion. So what we can do, there is also diurnal variations. When we go to sleep, its value is increased, or its values are also increased during stress periods, during physical stress, mental stress, and in some other conditions. So we cannot have a single measurement and can diagnose anything like acromegaly or growth hormone deficiency. So we have to do dynamic tests for the diagnosis. These dynamic tests, like insulin tolerance test, like we give insulin and there may be hypoglycemia. This in a normal healthy individuals, there should be a raise in the growth hormone values. But when there is deficiency, when there is acromegaly due to adenomas and it is secreted in large amounts, we cannot have raised measurement. So we have to do dynamic tests, dynamic provocative tests to diagnose the acromegaly, especially or gigantism or growth hormone deficiency even. So when there is growth hormone deficiency, there will be IGF-1 level decreased, and when growth hormone levels are raised, IGF-1 is as it is related to the growth hormone, their value must be raised with it. Next is we are just discussing the hormone secreted from the anterior pituitary. Next hormone is prolactin. Prolactin is secreted from the chromophore cells of the adenohypophysis and specialized cells these are. And main physiological function of the prolactin is the lactation. It starts lactation in the body in the females, and different stimuli increase the concentration of prolactin, like lactation, like there is a chest injury. These situations are, there are some drugs that induce the or reduce the concentration of the prolactin levels. This is also related to the impotence in human beings or men. This is also related to the metabolism of subcutaneous fat, carbohydrate metabolism, vitamins, calciums, and steroid synthesis. Clinically, I have told this is related to the hyperprolactinemia due to the adenomas, mainly prolactin excess. There is prolactin excess, and it inhibits the release of the. Now we will discuss another hormone that is called the adrenocorticotropic hormone. This hormone is secreted from the pro-opiomelanocortin, and as it is an opiate derivative, so it has some effects of sedation or in pain threshold, some effects, and it is cleaved from POMC, pro-opiomelanocortin, and then the derivatives are ACTH and MSH and the beta lipoprotein or these ACTH also have melanocortin activity, MSH activity, like when there is adrenal deficiency it causes the pigmentation of the skin, while we also have ACTH effects on the adrenal cortex and the synthesis of the cortex hormones, cortisol and all other glucocorticoids. So we will discuss adrenals with explanation in next lecture, inshallah. Now we will discuss some other hormone, that is the while discussing this hormone ACTH, we must know that it may be affecting the levels of the adrenals and other maybe there may be deficiency or there may be increased concentration of cortisol that have different effects, like that have Cushing syndrome or Addison's disease when there is deficiency of adrenal hormones. But we are not going to discuss today. This is enough today for today, and we will inshallah discuss these things in the next lecture. There is another hormone secreted from the adrenal pituitary, that is FSH and LH. These hormones are related to the synthesis and proliferation of the follicles in the endometrium and the secretions of the estrogens, progesterones, and in females, and the ovulation. LH is related to the ovulation of the LH hormone is related to the ovulation of in females after the follicles are matured by the actions of the FSH. While these FSH and LH, this FSH in males is related to the spermatogenesis and production of the sperms, while the LH is related to the secretion of the testosterone. There is hormone, thyroid stimulating hormone, which have effects on the thyroid development, thyroid follicle development, thyroid hormone synthesis, like steps. All the steps are regulated by this hormone TSH, which causes the iodine uptake, iodine and tyrosine combination, then the tyrosine deionization and formation of the thyroid hormone, and then the release of the thyroid hormone. This was the introduction to the anterior pituitary and the hormones of anterior pituitary. Next we will discuss the target organs and posterior pituitary in different sections. All the endocrinology will be discussed, inshallah, and we'll try to discuss it very briefly according to the fourth year level, and this will help you out throughout your life, inshallah. God bless you. Stay blessed. Allah Hafiz.